So I want to thank you all for coming, and thank you for the banter prior. I'm glad you got here today. As you know, I'm Vicki Barnett, State Representative from Farmington Hills, and with me today are my great colleagues, Cogen Lipton, State Representative from Huntington Woods, Ferndale, Oak Park, and Diane Slavens from Canton, and now you've got Belleville, right? Yeah, okay. And we're waiting for Renee Chelian, the founder of Northland Family Planning. And we're going to talk today briefly about access to women's health care and why it matters to Michiganders. In fact, it really matters to everybody across the country because women don't live in a vacuum. And what happens to the women in your lives and their health care really affects an entire family and the entire society as a whole. Now, you asked a great question earlier about why women need services specific to them. Our response to heart attacks is very different than a man's response. And we have special needs. We have a different anatomy that all of you are pretty much aware of. And we need breast cancer screening, Pap screening, pre, peri, and postnatal care, menopause care, contraceptives. So our healthcare needs are very, very different. But that's really only half the story because the truth is, as I said, women's health care matters to an entire family. Now, you who are here today know that this weekend my daughter has been in the hospital. And thank God she has access to health care insurance. Because if she didn't, the 5 days she's already been in the hospital plus the next 3 days under the care of a team of physicians in the neurology unit would bankrupt the average family. And the fact is most people in this country don't have free, easy access to health care. And that is why, another reason we're here to talk about the expansion of Medicaid, which would bring another 300,000 Michiganders onto the Medicaid rolls. The governor smartly has called for the expansion of Medicaid, but unfortunately the Republican leadership in the House and the Senate is blocking it. This week they came up with their own plan, however. It's a real charming plan that would say for able-bodied adults that you can have expanded access to Medicaid, but you have to pay 5% for that insurance that no other person who's on Medicaid in the country must pay for. And you can have access to Medicaid, but after 48 months, your Medicaid, if you're able-bodied, will be terminated. As if all of your chronic conditions, if you have diabetes or Parkinson's or any other condition, would suddenly disappear after 48 months. So the Republican plan will deny people access to Medicaid even though it's expanded because it creates new rules in Michigan that aren't enforced in any other place in the country. We believe that's a serious threat to families' viability, to health care, and again, as I talked about personally, my own daughter's experience, she has a family physician that she can call. Without Medicaid expansion and without good health care, people are falling through the cracks, and they don't have the ability to pick up the phone and call a family physician that is their doctor that cares about them and cares for them. So I want to now turn it over to my colleague, Cogen Lipton, to talk to you about some of the bills we are co-sponsoring today. Thank you.
Thank you, Vicki, and thank you, everyone, for being here. As Vicki said, my name is Ellen Lipton, and I represent 6 cities and 1 township in southeast Oakland County. And earlier this year, many of you know that the House Democrats did conduct a listening tour throughout the state with the idea of reaching out to voters and constituents to find out what issues were important to them. And one of the things that we heard repeatedly through these listening tours was that Michigan is letting down its women when it comes to accessing health care. Now, you all know that Michigan women represent almost 52% of the population in this state. We heard that, and we are today taking action. Based on what we heard, we've developed a package of bills and resolutions aimed at improving women's health care and their access to health care. These resolutions, including naming this week, May 12th through 18th, as National Women's Health Week in Michigan. Another resolution urges the Department of Community Health to identify and address the severe inequities that exist in the prevention, treatment, and research of diseases threatening women. There are substantial inequities in women's health care, and this resolution would call on the department to actually take a very, very close look and shed light on that. The third resolution urges the state to intensify efforts to reduce the rate of teen pregnancy. And the laws we propose would require health centers and agencies to offer emergency contraception to women who have been raped. This medicine doesn't end a pregnancy that already exists. It simply prevents a pregnancy from starting. And it's the humane thing to do. Another law would require the Department of Community Health to teach women about emergency contraception, including a description of what it does, how it works, and how to get it. We're introducing a proposal that would ensure our young people get accurate and age-appropriate and objective, sexually appropriate education in their public schools. And this is crucial because young people, need good information before they can make good decisions. We're introducing a bill that would require doctors to give women information on breast density and encourage those who have dense breast tissue to seek further testing. These laws and resolutions represent a first step toward improving access to health care for women in Michigan. These are first steps, and there are more steps to come. And to talk about that is my friend Diane Slavens. Diane?
Thank you, Representative Lipton, and thank you, Representative Barnett, and everybody for joining us today. I'm Representative Diane Slavens. I represent Canton, Belleville, Van Buren Township, which is in western Wayne County. You've heard about a set of laws and resolutions that we believe will make a real difference in the lives of women in this state. We look forward to getting these proposals passed into law over the next coming weeks. We know that by doing this, it will take bipartisan support, and we're open to working across the aisle to make this happen. But we also know that Republicans in the legislature have been working against women's health over the past 2 years. For that reason, we're urging the state and everybody who cares about women's health care to notify their representatives. They need to reach out to their legislatures to make this happen. They need to let their legislators know that women's issues and women's health care do matter. Together we can improve the health care of women in Michigan.
The most over-legislated field of medical care is with women's health. Nowhere is there an unprecedented attack on health care and access to health care except when it deals with women. Right now, it is so difficult for doctors, gynecologists to practice in the state and in a lot of other states because of the rules and regulations that legislators impose on physicians, not medical societies, not medical practices, not medical schools, but legislatures. So, for example, while we overregulate women's health care, and last year we passed a sweeping omnibus bill that deals with women's access to health care and the nature of the facilities in which women can receive certain procedures, and they now all have to be surgically ready. When you go to a urologist as a man and you want a vasectomy, the same conditions don't apply. You don't have to go to a surgery center that's medically capable of providing a hospital-ready environment so that you could have a vasectomy. There are no requirements for additional testing when your PSA level is at a certain point for prostate cancer or for a prostate exam. But when it comes to women, legislators across the country believe that they should invade the space between a woman and her doctor. And that's why we today are calling for a week for you to recognize the needs of women, their health care needs and priorities, and to make sure that women across the country have access to the care they so need without impediments put in their way by overzealous legislators.